Okay, so now we're talking about Chapter 21, Vulnerability and Vulnerable Populations. So the objectives: define the term vulnerable populations and describe selected groups who are considered to be vulnerable. Describe factors that led to the development of vulnerability in certain populations. Examine ways in which public policies affect vulnerable populations and can reduce health disparities in these groups. Examine the individual and social factors that contribute to vulnerability, and describe strategies that nurses can use to improve the health status and eliminate disparities of vulnerable populations. So people have different genetic compositions, right? So that puts us at risk depending on our environment, social environmental resources, different skills, support systems, and access to health service. So people with lower incomes and less education tend to be at higher risk for health problems because of lack of resources, lack of skills, support systems, and access. And then depending on your genetic composition, you get at higher risk. So a goal in the United States is to eliminate health disparities, and health disparities are where there is a gap in access to care, knowledge to care, all that, by expanding access to health care for vulnerable at-risk populations. And that's the crux of community health. So vulnerability, definition, and influencing factors. So vulnerability, all right, this is susceptibility to actual or potential stressors that can lead to an adverse effect. So this results from an interaction of an internal or external factor that causes a person to be susceptible to poor health. So when you're pregnant, you are vulnerable to infection because your immune system is low, right? Because you are susceptible. And vulnerable populations are groups with increased risk for adverse health outcomes because they are susceptible to actual or potential stressors. So it's not just people who are poor, right? It's also people with cancer, children. Children, no matter where you come from, are vulnerable and susceptible to actual potential stressors in their health, right? Because their immune system is lower. And it's more likely than the general population to suffer from health disparities. So when you talk about the flu, who's really at risk from dying of the flu? The really young and the really old, right? The really old are a vulnerable population. The really young are. Pregnant women getting the flu is really dangerous. People with cancer getting the flu is really dangerous. That's what you consider a vulnerable population. Health disparities, there's a wide variation in health services and health status among certain population groups. That's a health disparity, right? So there's a big health disparity among the elderly because they might not be able to get to their doctor. There's a big health disparity among African Americans because there's not that many reachable health centers. There is a health disparity for undocumented people because they don't speak English. So those are that's what we consider health disparity. So vulnerable populations. They're more likely to develop health problems as a result of exposure to risk or to have worse outcomes from those health problems in the population as a whole. So again, like we said, you're pregnant and you're exposed to whooping cough. You and your baby are more likely to develop a health problem than if I were to get the whooping cough, right? You're more sensitive to risk factors because they're often exposed to cumulative risk factors. If you are poor, hold on one second, my dog. Vulnerability results from the combined effects of limited physical, environmental, and personal resources. All right, so factors contributing to vulnerability. So economic status, poverty, lack of health insurance. Education. It is, astounding with lack of education, how much it affects people's health. Environmental factors. Do they live somewhere where they can't get to their health care? Do they live with smokers? Nutrition, right? If you have poor nutrition, you're at more risk for health issues. Stress, and prejudice, especially with the LGBT community. Health status, so looking at age, and then changes in normal physiology. Those are all the factors that contribute to becoming a vulnerable population, okay? So if you're illiterate, you're a vulnerable population in health because you can't read your medication. You can't read your instructions from your doctor. You can't read the phone number to call your doctor. Outcomes of vulnerability. They're negative or positive. Vulnerable populations often have worse health outcomes than other people in terms of morbidity and mortality. Sometimes when one problem is solved, then another one will quickly emerge, and that leads to a feeling of hopelessness, so then people are less likely to feel empowered to take care of themselves. So public policies that affect vulnerable populations. So we have Social Security is somewhat helpful, but not really, right? Well, it's helpful, right? It'd be better than getting nothing. There's Medicare and Medicaid, and that has since been expanded with the Affordable Care Act. Health Insurance Portability and Accountability Act. EMTALA, which, means you can't get turned away from an emergency. It used to be like, if you can't pay, you can't get your appendix removed and you're like about to have a perfed abdomen. So things like that have definitely helped, but it's not enough, right? I remember before the Affordable Care Act came, when I was in grad school, I didn't have health insurance, and then my husband had this crazy expensive health insurance, so we opted not to use any, but we needed to get our son covered, and they're like, well, he qualifies for the state CHIP health insurance program as long as you have health insurance. Okay, great. So then we tried to get health insurance outside of the crazy expensive work health insurance, and we couldn't get it because my husband had a pre-existing condition. It was so crazy. I mean, we could not get health care. Then we just went ahead and got the crazy expensive health insurance, and then that was what my husband's paycheck went to. So, it was crazy. The Affordable Care Act definitely took off the burden of that. However, it's still not perfect, right? Because it hasn't made insurance cheaper for the middle class, so they're trying to fix that. But these are ways that we can help vulnerable populations. But I will say this. When I first started in NP school, from when it ended, vulnerable populations have increased their access a lot. I remember meeting adults with asthma and COPD and them saying, these inhalers cost $50 to $100 a month, so I can't get them. I can only get one. Which one should I get? And then they would go to the ER all the time. So it is interesting how things have changed. So how do we approach the care in the community? So we trend toward providing more comprehensive family-centered services when treating vulnerable population groups. Kind of that one-stop service, wraparound service is the term, right? So when someone comes in, when we do community care for vulnerable populations, you're not just going to treat their asthma, right? You're going to make sure that they have, shelter. Here's a phone number of, CityLink. We can help your mom get a job. Let's immunize the whole family. So that's kind of that approach when we talk about vulnerable populations, especially, and I'm sure some of you see it in Mother Baby, if any of you work in that area. So Healthy People 2020, the objectives emphasize improving health by modifying the individual, social, environmental determinants of health. Vulnerable populations will always be a big part of Healthy People. I guess we're going to start talking about 2040 soon. Having a primary care provider who coordinates health services and provides preventative service, and that's part of the patient-centered medical home. To help with discrepancies, to keep people with continuity of care and consistency. So we talk about the levels of prevention. This is a really important part of community health. If you're not going to listen to anything, just listen to this, okay? There's 3 levels of prevention: primary, secondary, and tertiary. Primary is true blue prevention from getting a disease, right? So we talk about, flu vaccine to prevent the flu. We talk about healthy eating to prevent diabetes. We talk about not starting smoking to prevent COPD and asthma. Exercising while pregnant to prevent obesity and diabetes. Then there's secondary. Secondary is catching a disease early or preventing sequela from the disease. So a flu vaccine in someone with COPD is secondary, right? Because they already have lung issues. You're trying to prevent it from getting worse with early intervention. TB screening for those who carry TB. Mammograms to catch cancer early. Colonoscopies to catch pre-cancer early. Then tertiary, that is kind of going in once the disease process has set in and trying to prevent even worse morbidity and mortality. So therapy groups for severely mentally ill. Starting beta blockers for those who've had a heart attack so that they don't get the onset of heart failure. So understanding these levels of prevention are really important. And the focus on, we already know tertiary. That's what medicine was based on. Secondary, we're doing a better job. We still need work. Primary, that's a huge area. I mean, starting from the beginning, eat your 5 servings of fruits and vegetables every day. That is a huge part of primary prevention, okay? Because that's just going to right away improve people's morbidity and mortality. So assessment issues when you talk to a client. Socioeconomic resources. It's really crazy to suggest to do acupuncture for someone who can't even afford their monthly rent. Preventative health needs. All right, so you're a mother of 4, you're single, you're stressed out about stuff. You know what? You need to get your flu shot so that you don't get sick. You need to get a mammogram so that if you have cancer, you catch it early. Congenital and genetic predisposition to illness. Okay, so somebody here was born with, I don't know, tetralogy of Fallot, and they have not a great working heart. Well, you got to assess those things and figure out what environmental risk factors are there for them to have complications of that. Genetic predisposition to obesity or hyperlipidemia. Well, make sure you're on the statin and eating lots of fiber. Stress. Stress causes a lot of problems. It causes obesity, insomnia, depression, increased blood pressure, and then living environment and neighborhood surroundings. So planning and implementing care for a vulnerable population, you want to create a trusting environment. You want to show respect, compassion, and concern. It's so easy for us to sit and say, well, you can't afford your medicine, but you can afford your smartphone. Everyone needs a phone. I know it's annoying when people have a smartphone and they say they can't afford their medication, but you need to be respectful. You need to be respectful of people's priorities. Maybe that smartphone is the only way their kids get any entertainment at home. It's the only way that they can have an email address. It's the only way that, I don't know. You need to just be respectful. You don't make assumptions. Showing compassion. I mean, this is my hardest part. I get frustrated too. People tell me I'm not getting better, but they don't take the medicine you prescribe. You have to be compassionate. What is it? What is going on? Be empathetic. And then showing concern. Coordinate services and providers. Advocate for accessible healthcare services. Focus on prevention. Migraines is a big one. Okay, well, what is causing your migraines? How can we prevent it? Know when to walk beside the client and when to encourage the client to walk ahead. So when are you going to hold their hand and when are you going to push them forward? Know what resources are available to them and then develop your own support network for you to take care of you and resources to give to someone else. Okay, and that is the end of this section.